Core Measure 11, Clinical Decision Support Rule. The objective of Core Measure 11 is for providers to implement within their practice one clinical decision support rule that is relevant to their specialty or of a high clinical priority, along with the ability to track compliance with that rule. The measure simply requires that you implement one such rule. So when it comes to the requirements of attestation, Core Measure 11 is a yes-no, as opposed to a numerator-denominator type of reporting. So rather than being applicable to an X number percentage of patients, you are simply going to be attesting to CMS that you have in fact implemented at least one clinical decision support rule in your practice during the EHR reporting period. Within Prognosis, we refer to this feature as the expression. And the expression occurs at the encounter level as a pop-up. And this pop-up is defined by you, so it is 100% customizable, and you can also limit it to a specific role within the system based on assigning a property. Now, with regards to the content of clinical decision support rules that you implement, the policy as published by CMS does state that it must be something other than drug-drug interaction checking. You'll recall that that is actually mandatory Core Measure 2, which is a separate compliance entity. So therefore, in order to be compliant with Core Measure 11, the clinical decision support rule that you implement in your practice must be something other than validating drugs against one another or against their drug allergies. Now, beyond that, CMS does not actually issue specific guidance for the content of these rules. That is entirely up to the provider's discretion. However, CMS does stipulate or recommend that it should be based upon your local workflow, your patient population, as well as your quality improvement practices within the clinic. Basically, these clinical decision support rules are, some people refer to them as care protocols. They can be as basic as a reminder that remind your nurse that in this situation, if you're doing an injection, please use this gauge of a needle. Or maybe you're training a new medical assistant, and so for a new onset of something, you want to make sure they do the appropriate screening test before they do something else. You may treat a child with fever and diarrhea differently than an adult with diarrhea and fever. Or depending upon the other symptoms, you may want your nurse to follow a certain protocol in one scenario but not in another. So different things such as that would promote cross-training amongst your staff, ensure quality, that everybody in your staff who interacts with a patient is actually following the same routines and protocols, and things of that nature. And with regards to Core Measure 11, there is no exclusion, so it is a mandatory measure that you must implement at least one. Now, you can actually implement more than one, but in order to be compliant, you are attesting that you have done at least one. So we're going to toggle into Prognosis. And while we have our patient, John Dummy, we are going to go to his HPI screen. And we are going to say that John is coming to us today for depression. So we're going to bring in the HPI template of depression. And notice that once I save the template to my encounter, the system is going to give me a pop-up. And this pop-up is the clinical decision support rule, or the expression. Now notice the content is basically just text. It can be in paragraph form, sentence form, bullet form. That's up to you with regards to how you want to present this data to your staff members. It is a warning. It is an FYI. It is an action box. It can really be whatever you need it to be. Actually, it's a very wide feature within the system that you can use in a variety of ways. Now, to define the expression, we're going to go under Settings Configuration. And this specific property setup is something that is permission-driven. As clinicians and providers, by default, you should have access to doing this. Under your Settings Configuration menu, if you go to the Workflow column, which is the fourth column from the right, you go down to the fourth option called Expressions. And this opens up your Expression Master. And that one we were just looking at, the depression, I'm just going to select that. You'll notice at the bottom there is an Add New button if you wanted to create a new one. But just to see what one looks like, I'm going to open up the depression HPI that we just looked at. Now the expressions are basically divided into 3 sections when you're creating them. In the upper left here, we have what's called the trigger. And this trigger is where you determine the level of human interaction on your encounter that is going to prompt this pop-up. So for instance, in this case, under the event column, I am saying I want this triggered on my HPI screen. Now if I go into this plus sign, I could actually trigger it on any other encounter aspect that I want to. When I compose a mail, during my current medications, health maintenance, assessment and plan. Maybe I want it to pop up on my prescription screen, my radiology order, my vitals, etc. So you can have a combination of these as well if you wanted to. Then you can also restrict it to a specific HPI complaint. In this case, we've done it to the depression, but we could also say we want it to pop up, for instance, on the anxiety and any other mental health complaint that we may have. So you can have a combination of events and or HPI complaints that is going to trigger this pop-up. Now on the right-hand side, we have the rule or the message, and this is quite simply what's going to appear in your pop-up. This is free text. In this example, we have just itemized it out in a bullet list. Number 1, when your patient is having an HPI of depression, or now that we've added anxiety, please determine, is there a mental health provider involved? Now these are the instructions that you as an eligible provider are telling your staff, so that when they're evaluating the patient's HPI, they can go ahead and determine before you come in to do your physical examination, for instance, whether or not these things have occurred, so that when you go in, you'll know how to render your physical exam and the counseling or education that you provide the patient. It is free text. You can put sentences, bullet points, etc. And then thirdly, down at the bottom is where the power of this expressions comes in. Now this does get a little technical, and so don't be intimidated if you need to go through us with regards to either your implementation manager or technical support, or even in the training department to get some guidance on how to define these protocols. The one we're looking at here is a basic one. So we have triggered it on our HPI for depression and anxiety, but then down here at the bottom we have specified only when the complaint equals depression. We could go ahead and add complications down here. We could say greater than depression, equal to depression, like depression, in depression. So if the word depression is contained in multiples, we can say and or. So in this case, since we have now just added anxiety, we don't necessarily want it to come up only on depression. So we're going to say or. Come down to the second line and go ahead and choose specialty. Go into our plus sign and choose complaints again. So basically what we're doing here is saying that this is a special type of pop-up. We want it to be objectified by the specific HPI complaint that I'm about to define. And then here I'm going to put anxiety. Now, since I have now added a second line to my SQL query down here, and basically, for those of you that do understand the technical side of things, this is just a simple query that the database is going to maneuver. But as you may recall from algebra class, to take you back to school, you're going to have to use your parentheses here. So we're going to say begin it on this line, look at our complaints, if it equals depression, or if it equals anxiety, and that's the end of it. So we're starting our expression and we're ending our expression. And we're simply going to save it. Now you can build complexities down here, which we're not going to get into in this video. But to be compliant, this is what you have to do, at least one. So if you're a rheumatologist, for instance, you may want to create something about diabetic education or blood maintenance. You know, if you're a surgeon, you may want to include post-op care, discharge instructions. Now, a lot of these things can be handled elsewhere within prognosis as well. So again, this is at your judgment. Whatever you feel may be relevant as a clinical decision support rule to promote quality patient care and quality improvement within your practice. So with, again, regards to the compliance, basically, since it is an attestation of yes, you just need to make sure that you have gone into your settings configuration, expressions master, click the add new button, name the support rule, select and assign the applicable trigger or triggers, enter the rule, which again is free text, select and assign the appropriate conditions, meaning or remembering rather that if you are using 2 or 3 conditions to use the open and close parentheses to contain that equation, and then of course save your rule. Now, this is based on provider discretion, based upon your local workflow, patient population, and quality improvement practices. The objective, again, or the measurement requirements is simply that you implement one and be able to track it. The tracking would fall into the reporting capabilities of Prognosis. So if, for instance, you wanted a report of all of your HPIs that had this pop-up so that you could prove to an auditor that, yes, I have prompted this pop-up to my staff for them to follow, you would certainly be able to do that.